Good morning, everyone. This is Haley Callison. I am the Tulane University Biocontainment Institute Administrator, and I'm thrilled to introduce you to our next speaker. She's a true leader in ensuring excellence and continuous improvement. As the Assistant Director of Quality Assurance at Tulane University, Carys Kenway is the driving force behind their research quality assurance program, overseeing its development, implementation, and management. Carys brings a wealth of expertise to the table, holding impressive certifications as a Certified Manager of Quality and Organizational Excellence and Certified Quality Engineer from the American Society for Quality, as well as a Certified Associate in Project Management, or CAPM. Her work extends to provide crucial oversight for quality assurance and control across a wide range of initiatives, including Tulane contracts, national funding opportunities, biorisk management systems, and complex research programs. She's highly skilled in numerous quality and continuous improvement tools, including data and equipment management, statistical process controls, auditing, risk assessment, nonconformance management, root cause analysis, and corrective and preventative action planning. Okay, now after all of that, please join me in giving a warm welcome to Carys Kenway.
Thank you, Haley. So today our topic is going to be on quality management principles for biocontainment research, specifically looking at what processes and procedures we can use to enhance and improve the data and the safety of these environments. So we're going to go through an introduction section first. We're going to talk a little bit about what we're going to cover in the course and our schedule for today. So what are the objectives of the training? Today we want to ensure that we determine how you successfully build a quality assurance program within your biocontainment laboratory spaces. So we're going to talk a little bit about the decisions that you need to make as part of setting up your biocontainment operations and your quality systems that support that. And then we're going to introduce some of the tools that you might use to achieve that. Of course, we can't go through all of the tools and all of the skills that you will need, but we're going to go through a broad basis in order to start a successful program. We're going to look at how you go back and you assess the success of this program once it's implemented, because we're looking at always having continual improvement initiatives to ensure that we're constantly getting better and growing. And then finally, we're going to talk about what we can do when issues do arise, what tools we can use to identify issues and to determine how we can improve after we have identified those issues and the cause of those issues. So the key message today to take away is that really, when we're talking about quality assurance, it's a costly process. When we build quality assurance, it takes time, it takes resources, and it also takes cultural change. And what we want to do is talk about an approach which minimizes some of these costs while ensuring that our quality assurance program is a success. And because of that, we're going to talk about a risk-based method of implementation where we minimize costs while maximizing benefits. So here's the training schedule for today. During the morning, we're going to go through how we plan and how we scope out the quality management system that we want to generate within our biocontainment laboratories. And then we'll have a brief break. And after that, we're going to talk about how we go back and assess the success of our program and ensure we have continual improvement within that program. So first of all, let's just go back to basics. What is quality? So quality can be a very subjective measure, right? When we're talking about quality, we're talking about how something meets a state of excellence. And depending upon what the thing is that we're assessing, it might have different measures of quality. When we're talking about quality in research, we're looking at the program all the way from the top. So our quality management system, which encompasses the whole of what an institution might do. And that quality management system is overseen by quality assurance, usually a unit or a program that ensures that proactively quality requirements are met. What that means is they're making sure that things are of a high standard before they hit the ground, before they're used. They ensure the safety program is of a high quality prior to issues occurring. And by that, they prevent incidents, they prevent non-conformances, and they improve the rigor and reproducibility of research. And a subset of quality assurance is quality control. And quality control is how we measure the success of our quality assurance initiatives. It checks things in real time. It is reactive. So whenever we have issues or incidents arise, we can ensure that we are detecting them. So if a piece of equipment is no longer functioning, quality control ensures that that's detected before the equipment's used and has a subsequent impact on the quality of whatever that piece of equipment is measuring or being used for. And then the other thing we have to develop is successful metrics to ensure that we can tell the quality of the system. So depending upon what system you're measuring, those metrics might be different. So if you're looking at your research program, you may be looking at the integrity of the data, whereas if you're looking at your safety program, you're looking at the success of avoiding incidents. So why is quality important? So quality has both tangible and intangible benefits. And the tangible benefits are the things that really at an institutional level we're interested in. So improving the quality across the board will generally increase your profits and your productivity while reducing rework, incidents, other costs, liability, and waste. And this is critical because by improving the quality of your work, you can see that it has a knock-on effect for the institution as a whole. There are also intangible benefits of having a quality management system. And these are the things that aren't immediately obvious, but having a quality system can increase growth. If you're in a research environment, it can improve attainment of grants, awards. It increases your reputation as a whole. If you're known as an institution which is doing work of a high standard, of a high quality, it can improve your employee morale and your employee engagement as well. So before we even begin implementing a quality management system, we need to decide what the quality requirements are for your system. If you're working in a regulated environment, that's easy. So if you're working in an environment where you have a regulatory standard, such as good laboratory practices or good manufacturing practices, then obviously your goal is to implement those standards. But what about when you aren't in one of those environments? So there are a variety of different requirements we can conform to. Consensus standards are often standards which are built up from best practices and which ensure that we are in line with best practices across the board. We can also look at guidance standards, such as some of the ISO standards and the ISO guidelines, and then conformance standards such as ISO 9001, where you can actually have an external company audit you and assess you for your success of your quality system. But ideally, the quality management system that you use should accommodate your individual stakeholders and what they need. So if you have a lab that needs compliance with good laboratory practices, you may not use the same quality standards as a lab who simply wants to improve the standard of what they're doing and do higher quality research. In addition to the purpose, you need to determine the scope of your quality management system. What's your quality management system going to provide oversight of? If you're working in a research institution, you're not in an environment where your quality system immediately is across the institution. So if they're working with research laboratories, are they also working with your safety programs? Are they working with facility services to ensure that the labs themselves are providing a sufficient environment, controlled temperature, etc., for the work that's being done? So scoping out where your quality system applies is absolutely critical to ensure that your quality program has sufficient support from top management to implement the changes needed to be successful. And building on scope, you need to ensure that your quality assurance personnel, the people who are performing oversight, are independent from the areas that they're working with. They should have a direct report to top management. And in most quality systems, top management is located at the point where quality assurance meets the other units. So for example, in the image here, your quality assurance unit is providing oversight of both safety and research units. So top management is located above all of those three units, and they have an independent reporting structure. Now, it's absolutely critical that your QA personnel are crosstalk and work well with those other units, but having that independent reporting structure prevents conflict of interest, and it ensures that when issues do arise, they're handled appropriately by top management. The critical part of this is that your quality assurance personnel should never be engaged in the operations that they assess. So you can't have someone who is a biosafety officer who's also assessing the biosafety program for quality. Okay. So next we have a breakout session. And what we're going to do during this breakout session is discuss where quality assurance fits within your organization and whether or not the reporting structure of this quality assurance program ensures independence from the systems that the quality assurance program is overseeing. So we'll have 5 minutes for this breakout session. So what we're going to do is talk a little bit about implementing quality systems. And some of these are tools that you can use even if you're looking at your own programs and your own methods. And one of my approaches since I've been in quality assurance is to use tools which are simple, which are translatable to everyone, regardless of what area they're working in, and that are effective. And there's a process called the Plan, Do, Check, Act cycle. And you will see this cycle in so many industries. You see it in engineering, you see it in biotech, and they change up those words and they change up all of the different parts of it. But basically, it's a continuous improvement cycle. And the Plan, Do, Check, Act was the original time that it was coined. So that's why we stay with the original. And the idea is that it's a process that you use to continually improve what you're doing. And this is critical for quality assurance because it's very, very easy when you're working with a system to simply say, okay, I've gone in, I fixed it, it's working, it's great, without actually going back and doing the legwork and making sure that the things that you have done are effective. And from QA side, especially, we love to make people document things and, we get a corrective action and we add training, we add documentation, but unless we're actually going in and checking to make sure that those things are effective, I've definitely had situations where I've gone in and we've actually seen that adding additional documentation isn't a positive, it's a negative, it's not working for people, it's making lives harder. So anything that you do when you're working within a system, you should be going in and you should be reassessing to make sure that what you have done is effective. And the Plan, Do, Check, Act cycle is one of the most critical tools that we use. And so if you noticed our training schedule, the way that I've broken up the schedule for training is based upon the Plan, Do, Check, Act cycle. So in the morning, or in the first half, I guess, we're going to look at that planning and that doing. And then after our break, we'll look at the check and the act part of this. So within the planning, we're going to talk about strategies that you guys can use to actually implement quality systems. So since we're all in the research environment, we kind of talked a little bit about the general things that quality will do for a system. When you're talking about research, really one of the critical areas that you're looking at is the rigor and the reproducibility of the research that you're doing. And often when we look at these things, there's some very simple tools and techniques that we can use to improve rigor and improve reproducibility. But when you look at our lists here, so there are things you'd expect: adherence to protocols, SOPs, making sure that we have equipment that's properly maintained and managed, making sure that we have tracking of test control articles. All of those things are things that you would expect within a basic quality system. And the same with the tools to implement reproducibility. But one of the challenges that we have is a lot of the research that we do is not subject to quality standards. So these critical areas that we need to enhance the rigor and reproducibility of what we're doing are expensive, and they require a lot of resources from the institution. They require a situation where you really need to have a lot of resources to do it. So if we want to enhance the rigor, the reproducibility, and even the safety of the research that we're doing, how can we determine the critical areas that we want to look at? So one of the first things that you want to do as you build your quality system is a process called benchmarking. So when you're benchmarking your system, what you're looking at is mechanisms via which you can improve what you're doing and either bring it in line with your similar organizations, or alternatively, slightly better than your sister organizations. So what you usually want to do is pick institutions that have similar processes to you. Maybe they have So they have a similar level of research. Maybe they have an animal research program. Maybe they have a BSL-3 or a BSL-4 program. And what you can do is you can look at where their successes are and what areas they have used in order to improve and grow as an institution. And maybe you can see an area in which you have not added tools as your institution, but they have. So you go through a very simple process of identifying what areas are important to you. So maybe it is your data integrity and your safety. You identify who your sister organizations might be, so which organizations are of a similar size and do similar research, and how you're going to collect the data in order to determine where you can make improvements. And you can look and you can see what areas they've done. Maybe they've added a type of research that you haven't considered. Maybe they're using processes and procedures that you haven't considered. And then you use this to integrate what they've done into your current program, okay? And in a very similar way to our plan, do, check, act cycle, you can use the information from benchmarking to develop plans in order to build and grow your systems and your programs. But at the same time, you're ensuring that you're developing in a way which is appropriate for your type of institution. So by benchmarking, you can identify your performance gaps that exist within your quality and your biocontainment programs, and you can identify the best practices within those systems. But then another thing that this does is it also enables you to determine what sort of things your stakeholders, so your external stakeholders, your funding agencies, and maybe even your regulatory agencies are looking for. And the goal of all of this is to give your organization a competitive advantage in safety, in data integrity, and in really having a biocontainment research system which is excellent. So all of that sounds great, right? We've talked about having a defined purpose and scope and looking at other organizations and benchmarking to determine your critical quality factors. But once you have all of that information and you really know what you're going to build your quality management system into, how can you implement that? And that's one of the biggest challenges, because I've said over and over again that quality can be costly, right? And oftentimes, especially right now, if you're in NIH-funded research or similar, adding something which is expensive is not a good way to proceed. So what we want to do is add quality in a way which minimizes cost, but maximizes the efficacy of the system. So what you'll often see are things like this. This is a beautiful quality ready checklist, right? This is all of the things that your organization should do within your labs, within your biocontainment programs, in your spaces, to make sure that it is of highest quality. If you were to implement all of these things, you would be GLP compliant. If you add clean rooms, you'd be GMP compliant, right? This is a list where you sit there and you go, check, I've got this. This works. This is great, right? But again, what this goes back to is this isn't easy to do. If any of you are familiar with the equipment management for your facility, I know several of you are, things such as calibrations are incredibly expensive. So to turn around in a lab such as the ones we have and say, okay, cool, I'm going to calibrate everything, it's just not possible. So if we really want to build quality into our organizations, especially in labs which are not required to have a regulated quality standard, we have to think outside the box. So these quality ready checklists are great if you need regulatory compliance. So if you are aiming to be a GLP lab, if you are aiming to comply with your ISO 9001 standards, this is a very easy way to do it. It makes sure you're consistent. Your QA team will love you because all they do is walk from lab to lab auditing and making sure you're hitting those standards. It's very much an end game solution, right? It works for labs who have a quality system implemented, but it's expensive. It means that you're doing a one-size-fits-all solution. So it doesn't matter what that centrifuge is being used for or what that balance is being used for. You're going to calibrate it. You're going to QC it every time you use it. And it's not necessarily going to be an effective use of your resources. And it focuses critically on having quality for the sake of compliance rather than for actually using quality to improve your data and to improve the safety of what you do. So one of the things we're really going to focus on today is this idea of risk-based quality assessments. And when we're talking about a risk-based quality assessment, we're taking that quality checklist and we're looking at it from a different point of view. So rather than saying this is the checklist of what we need to achieve, instead we say, okay, this is the gold standard, but what can we do to ensure that the things within our system, our program, that are most critical and are highest risk are being addressed first? Okay, so if we use a risk-based system, it reduces immediately the resources that you need to implement. Okay, I'll keep going back to that equipment management. And the reason I keep hitting equipment management is it's one of the most expensive things to do. And it's also one of the things which is most lacking in this level, in this area of research. So if you suddenly say, okay, I don't need to calibrate every piece of equipment, but I want my freezers that are storing test articles being monitored, you suddenly reduce the cost of your quality system. It makes sure that when you're working with labs or you're working with groups, you can address their major concerns immediately. So we've sat down with groups where their big concern is they have too much paperwork. How can we streamline the paperwork, make it easier, make it more effective? And by doing that, you very quickly get stakeholder buy-in, okay? You focus on quality for the sake of quality. And it doesn't mean that everything is 100% compliant with a regulatory standard, but it does mean that the data that's coming out of the lab or the safety program that the QA group is assessing is more effective and works better. Now, of course, the con to this is if you do need that GLP compliance, you're not going to hit that GLP compliance. I have a mistake here apparently because it says it's cost prohibitive. It's not cost prohibitive. That's an error in my slides. The other thing is different standards in different areas can cause confusion. So for example, if you have a group who's working with different labs who have different quality standards, that's challenging for them. And then the final con of this is that it's more work for your QA group. Your QA group can't simply say, okay, here's our standard, let's hit it. Instead, they have to say, here's the requirements that we're looking at for this area based upon the risk of the things that they are doing. So the ultimate solution to address the pros and cons of both of these two systems of implementation is to use your risk-based quality system to eventually reach the point where you can use a checklist system. And that's really what we've done at Tulane. We've grown from being, hey, here's our risk-based approach to this lab to, okay, as the risks of things get lower, then you're more and more moving towards that ideal situation where you have a fully implemented quality assurance system. So how do you even begin to look at things if you're looking at things with a risk-based manner? So we use a system which is listed here called a gap analysis. And this is truly one of the best systems I've seen for quality implementation because once you have the buy-in from the stakeholder, be that your biosafety program, be that your lab that you're working with, you can usually develop a quality implementation which fits their needs and their requirements. So what we do, and a good way to manage your quality system, is to meet with the lab or the stakeholder and assess what they're doing and what they need. So, for example, you may have a situation where your biosafety program needs to be able to comply with some of the ISO 9001 standards, or you may have a situation where your lab has been asked to do one of my least favorite terms in the industry, be GLP-like, right? So you need to work with the individual group to determine what they need. And then we use this system called a gap analysis to determine where their major gaps are. And I'm going to talk a little bit more about how we do that, but our gap analysis is essentially what you guys who have a biosafety background will know as a risk assessment. So we go in, we look at the gaps, and we risk assess it to determine which of those gaps are critical to the quality or to the safety or to whatever factor is important for that particular group. From that, you can generate a time-bound action plan. And the time-bound action plan is the buy-in from your stakeholder. So you sit with them and you say, hey, do we want to implement quality in a year? Do we want to implement quality standards in 2 years? What works for you? And by doing that, again, you're using their requirements and their desire to reach the standard of quality to build a time-bound action plan that works for your stakeholder. And you're going to hear that works for your stakeholder a lot, because one of the things that is most effective in building quality is to have a stakeholder who wants the quality processes. If you have that, this is all going to work a lot more effectively. And then you can go through a very simple process of making sure that the time-bound action plan can be adjusted to meet the stakeholder needs. And then eventually you're going to hit a point where you've reached the end of that time-bound action plan, and you move into this kind of continual improvement maintenance status where you're constantly trying to get better. You're constantly trying to improve what you're doing. And you're really looking towards building a system where the stakeholder is a key player in your quality management system. So let's talk a little bit about what risk assessment is and how you can utilize these tools to build quality in your lab. So if you're from a biosafety background, there's nothing new here. But when you're looking at risk assessment, you're interested in hazards. And your hazards are anything that could cause harm. So in the case of a quality management system, and especially a quality management system for a research institution, one of the primary sources of harm is a data integrity issue, right? This could be data that's poor. Could be data that gets lost because maybe your study wasn't performed correctly. This could even be falsification of data. Those are your quality risks with your system. For you guys who are in the biosafety background, you're concerned about biorisks. You're concerned about risks which are potentially going to cause a breach of containment or cause exposure, right? All of these risks can be calculated, and they can be calculated through risk assessment, and it's based upon the likelihood that that risk is going to occur multiplied by how bad that risk is or that hazard is when it's realized, right? So the severity of the outcome. And we use exactly the same measure of risk when we're looking at quality management systems. So when you're looking at risk assessment, you want to make sure that you are evaluating your risk and you're determining what areas are most critical to ensure that the research or the safety program that you're overseeing is working in a way to reduce risk. The way that you do risk assessment is going to depend on what resources are available to you. So there are two types of risk assessment. There's quantitative risk assessment and there's qualitative risk assessment. Quantitative risk assessment is extremely high quality level of risk assessment. It usually requires a piece of software to run it. It usually requires expertise in risk assessment from the team doing it. It's very expensive and it takes a large amount of time. These risk assessments can be critical in the industry for things such as dealing with epidemiology and outbreaks, etc. But it's not something that's practical to use on a day-to-day basis when you're implementing a quality management system. More importantly, quantitative risk assessment often requires extremely good data going in, and we just don't get that level of data when we're working with these labs and with these systems. So what you can use is a qualitative risk assessment. This is a much more subjective way of performing risk assessment. However, it's quick, it's cheap. Your team would be able to do it with a relatively low level of training, and for implementation of a quality system where we're really looking at the areas that we want to work with, it's perfectly effective and it's accurate enough for the purpose. That being said, one of the best ways to reduce error in your qualitative risk assessment is to have a subject matter expert involved in that. So I can tell you if we are doing a risk assessment of critical to quality factors for the biosafety program, it's not going to be a team of QA people sitting in a room. We're going to bring in biosafety officers and have them give us information on what we're doing. If we're doing it in a lab, we'll be talking to the lab about their processes and procedures. By taking a group of people who are subject matter experts, when you're doing these risk assessments, you massively improve the accuracy and the data that you generate from them. So once you have the information, we use a very, very qualitative system called a risk matrix, and you're probably all fairly familiar with these. There are a variety. They can be as small as a 3x3, which makes your life very, very easy. I have seen three-dimensional ones where they calculate their likelihood but from two factors. So what I have here is kind of an intermediately complex one. It's a 5x5. It gives you enough range to be able to classify out your risks, but it's not so complicated that it becomes a challenging tool for you to use. And the goal of using a risk matrix like this is to assess all of your risks to quality and to assign them based upon their likelihood and severity a level of risk. And then it's up to the organization to choose what risk is acceptable for them. So for example, when we're implementing quality management into our labs, if we have risks that fall out in this low or this very low parts of the risk assessment matrix, we're generally going to say those are low priority. We're not going to worry about those now. We're only going to worry about those if we need it for regulatory compliance later down the line. But whoever's overseeing the process can choose what level of risk they find to be acceptable. So you should have a system within your risk assessment process to categorize your severity and your likelihood. So this is an example of how you can do that. I mentioned we had 5 groups. So your likelihood, we have running from rare through to certain. And then for each of these, you want to provide a description of what that means so that when your team is doing a risk assessment, even though this is a qualitative risk assessment, they're using the same standards, because if they're not using the same standards, then your data is meaningless. So here we have a system where your rare events really are things which are not very likely to occur. And actually, they're more likely than anything things that you hope will never occur in your industry. But most of your events are going to fall into this kind of possible to likely range, right? A lot of the incidents that we see that are quality impacts do occasionally happen, hopefully not too much. And what you can do is you can classify each event as how likely it is to occur. So for example, if the hazard is that a piece of equipment is not functioning and gives you some wonky data, all of those are going to be within this range of certain to possible, right? Depending upon what it is exactly that you have within your system. So, Luis, I see a question in the chat. Does the black swan fall under the rare or unlikely? You're going to have to elaborate what the black swan is.
Yeah, the black swan, it's a very rare event, but with catastrophic consequences to the system.
Yes. So it would fall, let me go back one slide. So you will notice that most things which are your black swan events, right, are going to fall into this rare or unlikely, but because they're severe in our system, they would still have a medium risk, which would mean that they would fall under something that needed to be managed. So a little bit of this depends on how you build out your risk assessment matrix. But when we built ours, we wanted to make sure that any of those severe or major events, even if they were rare or unlikely, would be things that we would address. So my recommendation, because you have some flexibility in how you build out the matrix for your institution, is to make sure that even if something is in this rare or unlikely category, you do have mechanisms built in to manage those occurrences, because you don't want to ignore them, because they absolutely do have a chance of happening. And when they do, they are very severe. So in addition to assessing the likelihood, you're going to assess the severity. And what the severity is dependent upon the type of risk that you have. So again, we're talking a lot about quality risks because we're in university research. We're talking about biological risks. So those are the 2 examples that I've given. But remember, there are also legal risks, there are financial risks, and all of them will have different severities depending upon the consequence. So depending upon what risks you're assessing, you would have additional columns here built out. But when we're looking at our quality risks, we're really worried about the data. And those, we kind of vary those from having very little to no impact on data to having major losses of data. These are your GLP major study deviations. These are things which have a significant long-term impact. And then when you're talking about biorisks, anything which is not handled within, that can't be handled internally, that becomes an external issue where you're having to bring in your your external agencies, etc., move into those moderate, major, and severe categories. So once you've gone through the process of identifying your risks, this is a process called a SWIFT analysis. It's actually a modified SWIFT analysis, but we use this to create a risk register. And the risk register is how we document for whatever group we're working with what their current systems are. So you can see this table lists the risk description, and I've just given a little, this is a biosafety example below, right? The risk description is where you have an area of risk, so incorrect PPE doffing, the impact, and I always have to tell our stakeholders when I show them this, the impact is only what would happen if the risk were realized, right? It's not what you're seeing in the lab when you're going in, because especially when you start looking at quality factors, you don't want them to make the assumption that the risk that you're presenting and the impact is something that you saw when you went through the lab. And then you want to include, when you do a risk assessment, what the current practices and the procedures are, right? Because if you go in and you assess all of your risks and you don't factor in the current practices and procedures, you're not going to have an effective assessment of what's currently going on in the lab. And this is critical for quality, again, because if you're going into a preclinical environment where there are no pre-existing quality systems, they may have lab practices that are actually giving them a much higher quality of work than other labs without even realizing that they're there. So we always assess what they're currently doing. And then this is what we just talked about. You assign it a level of severity and likelihood, and then this gives you your risk. So again, for the way we have ours set up, if anything is medium or higher, it requires a corrective and preventive action be issued. And we're going to talk about those a lot in the second half of this training. And then whenever you identify these critical to quality factors, you want to make sure that these actions that you're asking people to do are assigned to a person. So you want to make sure that there's someone responsible for helping remediate and improve and fix the issue that has arisen. These risk assessments that you're doing as part of your implementation of your quality system should not be static documents. And I'm going to say that for everything. SOPs shouldn't be static. Your policies shouldn't be static. Anything that you're doing to build a quality system should be continually assessed and should really also be assessed anytime that your procedures change or anytime that they need an update. Maybe there's a new industry standard, etc. And then once you've completed this gap analysis and you have your completed risk register, you can use this to guide how you implement quality management within the system that you're working on. So the next breakout session is going to be a little bit longer. So you guys are going to have about 15 minutes for discussion. And there are going to be 2 points of discussion. So do you currently use risk-based assessments to drive process implementation in your area of expertise? So if you're in safety or if you're in lab management, do you have any risk-based approaches to what you're doing? And then the next part of this, based upon what your role is, what factors do you think are critical to the quality of your area, and how do you think those factors might play into your day-to-day improvement systems? Okay, so if you can please open the breakout rooms. Okay, so we're going to move on to the next part of this discussion, which is the do part. And this is the building your quality systems, right? So you have determined where your areas are critical that you want to address and how you want to address them and in what order you want to address them. We're going to talk fairly briefly about how you can start addressing those from a quality perspective. So your quality management system should have a variety of different tools and procedures that it uses in order to implement quality assurance. This is an example of a service list, right? A lot of it is what you would expect to see from a quality department. So SOP development, document control, training, management of critical items such as test and control articles, etc. But what you really want to think about is, given your critical quality factors, what tools can you use as part of your CAPAs to remediate those quality gaps that you have identified and ensure continuous improvement? And what we're going to do is we're going to talk about some of these tools, and we're going to talk about the ones which generally in research laboratories prove to be the most useful. Now, it wouldn't be a quality assurance discussion if we didn't talk about documentation, because documentation is fundamental to everything that quality assurance units do, and is often why people associate quality assurance as having a lot of red tape. But the reality is this very simple little statement down here is if it isn't documented, it didn't happen, right? So we want to make sure that we have a documentation structure that is effective and that is efficient, but make sure that everything that you need to record is recorded. So ideally, in your document system, you'll have a hierarchy of documentation. And what that essentially means is that your documents are going to start at a top level, which are your institutional level documents. They define the why of your system all the way down to the form and the data that are generated within the labs as records, as observations, etc. So your why is your institutional policies. Your what are going to be the policies that are generated at your unit level. So for example, your biosafety policies, your quality assurance policies, etc. And then your procedures are really the day-to-day operational documents that tell you how the things that your quality system are requiring are carried out. These might be your lab SOPs, these might be your instructions, etc., that are provided to personnel, your equipment manuals, etc. The how are your day-to-day things, right? So these might be within your biocontainment space, your donning and doffing instructions that are on the wall. They might be your checklists that the lab personnel are bringing into the lab and using when they're in the lab. And then critically, the proof of whatever system you have, right? So your raw data, your records, your checks sheets, your sign-in sheets, all of that should be part of your documentation hierarchy. And your quality management system should have a process to maintain all of these documents, to manage all of these documents, and to archive all of these documents. So as part of doing that, you should have all of that in a defined system. So you're going to have quality management policies that will outline the system itself. And then when you have labs or you have offices working under the quality assurance program and they're preparing their own SOPs, they're going to prepare it in accordance with the quality management system that you've generated. So I have a list of SOPs here. This would be an example of the SOPs that you're probably going to generate, or the policies you're going to generate, in order to define the quality management system that you're generating. And again, these are much the things you would expect, such as how you're training, the training requirements that you need, not necessarily the individual training requirements someone would need within your lab, but what that training program should look like. For example, for materials management, you're not necessarily going to say exactly how your reagents should be labeled, but it's going to define that your reagents should be labeled, that they should be identifiable. So you want to generate a structure of QA policies which really define the system as a whole. Now, as part of your document hierarchy, you want to make sure, and this is always one of the challenges as you start to create a huge amount of documentation, that they are managed in a way which ensures everything's approved, everything's working, and the documents reflect what's being done in the lab. And I can't state how critical this is. It's very, very common for people to write a beautiful, long procedure or policy or SOP or anything else within the document hierarchy that sounds great. But then when you go in and actually watch people working and functioning, it doesn't necessarily reflect what's written in the documentation. So making sure that the documents that you have actually reflect the processes and procedures that you're using are critical for effective quality. So anyone who's reviewing your documents should be looking at your documents in accordance with documentation best practices. So they're making sure that the document is accurate, it's readable. One of the things that I constantly remind everyone when they're reviewing documents is making sure that the document is appropriate for the person using the document, right? So if you are writing a document where everyone who's reading it is a biosafety expert, then there are things that you wouldn't have to define versus when you're preparing a document maybe for facility services, right? So you want to make sure when you're reviewing these documents that the audience is factored in, because if you don't, if you write every single document that's part of your quality management system for the layperson, you're going to have documents which are 50, 60 pages long and just don't work and just don't function. And a critical part of what we try and enforce when we're doing quality is, yes, there's a lot of paperwork, but let's make it efficient paperwork. Let's make it paperwork that's usable by the people who are working with it. So you want to develop an approval process, which ensures that your document is reviewed not only for the technical content, and that technical review should be performed by the people who are subject matter experts and who are going to be using the document, right? And then you want to make sure that you're also reviewing it from a quality side for compliance, for making sure that there are appropriate quality control mechanisms built in. And then if you're building a document control system, you want to make sure that you have some level of approval. All of your documents should go through approval, and this is to protect the people who are using the documents. So if you've generated an SOP and it's signed off on by leadership, then the personnel who are working in this system and using the documents, if they're following the documents, then they're doing the right thing, right? And if you don't have that upper end approval, you lose that. And then by having a quality assurance system, especially if you have a defined quality assurance unit, all of the responsibility for document control, for versioning, for tracking histories, for archival can all be shifted onto your QAU. And what that means is that it becomes much less of a burden for the labs. The labs no longer have to keep records of back in 2015, which procedure they're using, because it's all being managed through a quality system. So the document control system that you build out needs to be something which is efficient and effective. Now, my dream is to have eventually an electronic system. Electronic document control systems are fantastic and they remove a lot of the legwork for your QAU. But the reality is that they are, again, cost prohibitive for many institutions. And so making sure that you have in a system that allows for flexibility is critical in research, because a lot of the concern that I see that comes out of stakeholders, especially principal investigators, when it comes to SOPs and document management, is as soon as you have that release on it, they think they can't be changed. So making sure that you train all of the people who are working with your documentation that these are fluid documents, that they can be updated as you need, and critically having a fast review and turnaround process is critical to having an effective documentation system. So when you build it out, it should be something which ensures that generally you want to have your documentation in this day and age electronically available. We learned that in COVID. You want to make sure you're tracking your versions of your documents, because if you're not, you're going to lose historical information. And generally speaking, you want to limit and access the distribution. All of that should be managed through your quality assurance group. The other facet of documentation, which is critical for many of the quality processes that we address, is good documentation practices. Unfortunately, every time I work with different groups, the amount I have to talk about good documentation practices decreases because so many institutions are now using electronic notebooks, which basically handle a lot of your good documentation practices. But there are still records that need to be generated in accordance with good documentation practices. And when we're talking about good documentation practices, we're talking about making sure that you have people signing, dating raw data as they generate it. And this isn't just your data generated in your lab. These are things like access records. These are things such as equipment QC logs, anything where someone's recording data. You want to make sure that they are writing in pen, blue, black pen, and that data is being recorded in real time. And actually recording data in real time is always one of the challenges in biocontainment spaces, because you want to make sure that people are doing it safely. So when you want to make sure that as you're designing forms and documentation mechanisms, you're designing them at logically consistent points where people are not within the biosafety cabinet, where people are able to record the data that they're generating. So these are all things that as you build your quality management system into your labs, you should factor in. And then you want to obviously make sure that all of your data generated in your labs is original, accurate. And these practices apply whether or not they're recording data in an Excel spreadsheet during lab work or whether they're recording it on paper. So training programs are another critical part of implementing systems to combat your critical quality factors. And training programs can often be hard to assess and measure. So making sure that as you build out your training systems, you have a way to make sure that they're effective. Having employees sit and listen to a 1-hour lecture and that's their training checked off is often not as effective as having systems where you're working with those employees, where they're doing on-the-job training, where they're learning, and oftentimes demonstrating ongoing proficiency. So in lab work, we see a lot of drift over time where people maybe simplify procedures, find ways to do it quicker, And if those are not appropriate for the situation, they start to reduce the quality of the data that we see. So we want to make sure that how your training is being structured addresses not just initial trainings, but proficiency, ongoing training, and ways in which people can show that they are continuing to enhance their technical expertise. Materials management is one of the areas where you need to have a risk-based approach to the way that you're implementing your QA. And the reason I emphasize that risk-based approach, Luis mentioned in the chat about the current situation with financials within institutions. So I'm going to mention supplies here. So ideally, if you look at a quality system, you're going to say that anything in your lab that is expired shouldn't be used, right? If you have a requirement to be GLP or anything like that, you can't use expired supplies. But right now we're in a situation where a lot of our institutions are suffering from major budget cuts. And one of the things you might want to think about from a risk-based approach is, okay, is an expired 50 ml conical something that's actually posing a risk to the quality of the data that I'm generating? And if the answer is no, then you want to make sure that as you build out your policies, you're factoring that in. Now, there are supplies which might be critical, right? If you're starting to look at PPE, for example, you don't necessarily want to use expired PPE because you're starting to implement a biorisk. So using that risk-based assessment when you're looking at your materials management system is absolutely critical. So the way that oftentimes it's classified, and we've kind of used the risk categories here from low to high, is that in your average lab, right, your average BSL-2 lab, your supplies are probably going to be your least subject to quality assurance requirements relative to your other materials within the lab. So for example, supplies here, you want to make sure that they're not deteriorated, you want to make sure they're of sufficient quality for use, but really they're not subject to too much additional quality standards. And this is based upon a risk-based assessment of how supplies are used. Whereas when you move to your reagents, when you start thinking about things which are being mixed with samples, which are being mixed with maybe test articles, you start to increase the stringency of your quality standards. Once you move into samples and specimens, right, you're controlling these even more. You're making sure that you have chain of custody, vial by vial inventories, because these are much higher risk things. If you mix up samples, if you mix up if you mix up samples, specimens, if they're going to the wrong place, if there's potentially a biorisk associated with their samples, then that's a problem. And then obviously in any quality management system, your test and control articles are extremely critical because these are the things that are being administered to your test systems. And if there are issues, identification issues, then you immediately have a problem with how your data is being generated. So I see a question in the chat with comments use of expired nitrile gloves. Use of expired PA. So this is something which if it was brought to me, I would actually, my first question would be, what are the gloves being used for? Because if they're being used for a biorisk, I would pull in Anne-Marie. Sorry, Anne-Marie, I'm going to throw you up there. So this is one of the examples where quality and biosafety meet, right? So my response would generally be that we shouldn't have expired supplies in the lab, which are PPE, but I would definitely bring Anne-Marie in. So do you want to comment on that, Anne-Marie?
Yeah, I think my comment definitely would be to I think a lot of times it's asking the question back to the lab users. Like, do you think that are you 100% confident that the integrity of this glove is not compromised based on the how old it is? And also the things about what you're doing too is also important. But yeah, I think any use of expired PPE, I would argue against it. And the BMBL is a guidance document too. And it's not necessarily going to talk about the quality components of use of expired materials. So I think that's also important for people when they argue with you about, well, the BMBL doesn't say it. Well, it's like, yes, it's a guidance document on biosafety, but let's also look at the quality of the work and the safety of the work that the BMBL doesn't get down to the details of it from that part. So yeah. The argument of the BMBLs is very interesting to me because I also argue back that it's very institutional dependent in the work that you're doing. So it's like, yes, this is what the BNBL says, but let's enhance that. Let's dig in deeper to why you think it's okay to use expired gloves, and you know, I think getting that buy-in is really important too, because they'll argue and say it's fine. So, but when you take that glove out and it rips, trying to put it on because the integrity is not as good. And you know, that I've seen that before too, where you go into a laboratory and you grab gloves and you pull the first glove out and it just rips on you. So, but yeah, that's actually a really good question. And for me, I would definitely bring it back to a conversation and getting the buy-in from the laboratory on the safety and quality side. So.
And getting that buy-in is critical, because we've definitely seen it in the last budget year. Some of those conversations have changed, because things which we definitely would have said, no, you can't use those anymore, we've had to be more relaxed, because a lot of PIs, their fear right now is, when are they next going to be able to purchase replacements? When are they going to have the funding to do that? So looking at really having those discussions of, is this something which is still of a high enough integrity for use, is absolutely critical to working with your stakeholders. If it's a reagent, if that media is starting to turn pink and purple, then it's probably time to get rid of it, and it's fairly easy to tell. But when you're talking about things such as plasticware, etc., it's a much more difficult conversation. So, great question. Another area that's often overlooked in your quality management systems is your supplier management. So when you're looking, and it's interesting that you brought up gloves here as well, because especially for PPE suppliers or suppliers of things which are critical to the integrity of the work that you do, making sure that you build out a supplier management system is going to have a big impact on the quality of what you do. I think that a lot of people, we go with the supplier that we've always used before because we've not had any problems with them. That's kind of the start of your supplier management system. So you want to build a system where you are reviewing and making sure that your suppliers are working well, especially when you have a new supplier. You also can build in data from other labs. So maybe someone's had a good experience with a supplier, or maybe someone's had a bad experience with a supplier. But by having a quality system where you generate a supplier database that provides you with the information that you need in order to accurately assess your suppliers is absolutely critical for many of your critical quality factors, because they are playing a role. They are servicing your equipment, they are providing your reagents, your supplies, etc. And if they themselves don't have good quality management systems, that will have a knock-on effect for a lot of what you do. Again, struggles in non-regulated research. A lot of your PIs want to buy the cheapest. They want to buy the thing which they can get fastest. It doesn't always necessarily mean that they are picking good suppliers. And for things like fridges and freezers, if you pick a poor supplier and buy a -80 that has consistent problems, in the long run, it's a big cost. So having a way to categorize and classify your suppliers, and we just have a little example listed at the bottom, will help your PIs and will help your labs develop better quality systems. So the last part of our do section, I'm going to talk a little bit about equipment management. And the reason, again, I'm focusing on equipment management is this is one of your most expensive areas of quality implementation. And really, this is where the risk-based approach shines to save you money. So obviously, your quality management system is built up of a variety of different areas: QC calibration, operation of the equipment, and then routine and non-routine maintenance situations. And what we're going to do is talk through an example of a risk-based approach for a centrifuge. So I have 3 laboratories for you, and stay familiar with these laboratories because it's going to go into our breakout session in a moment. We have a BSL-1 lab, okay, which is used to prepare drugs, test and control articles, okay. You have a BSL-2 lab that's used to process samples, and a BSL-3 lab that's used to prepare viral cultures. And they all use their centrifuge for different reasons, right? So in your BSL-1 lab, all they're doing is that very simple process where you spin a tube to try and get everything to the bottom of the tube before you use it. Okay, in your BSL-2 lab, they're doing density centrifugation, which is very sensitive to the force that the centrifuge is exerting on the sample. And then in your BSL-3 lab, you have a situation where you're centrifuging viral cultures, right? So highly pathogenic, potentially dangerous materials. And by using a risk-based approach, you can determine where you should focus your equipment management system, right? So would probably even here classify our highest risk areas, our BSL-3 lab. Why? We're not too worried about the speed, right, of the centrifuge and the temperature necessarily if that viral culture is not susceptible to it. But in your BSL-3 lab, those centrifuge rota buckets are serving as a method of primary containment, right? So when you're thinking about your equipment management system, your focus in this lab is on developing a system to check that your rota cups are effectively serving as a method of primary containment. So how would you develop a QC system? How would you make sure that they're functioning, that they're effective? Does anyone have a way of doing that, just out of interest? Does anyone check their rota buckets to see if they are serving as primary containment and not leaking?
Yeah, I think you would look at the O-rings. I think a lot of labs forget that there's O-ring, that there's an additional part. It's not just the cap. How that O-ring fits on the cap is very dependent on the equipment too. So making sure that I think that would be really important to have identified. Because if you ever need to replace them, make sure you're replacing appropriately. And maybe cracks for the caps and cracks on the actual rotor itself. Checking, just routine checking and verifying before use.
Absolutely. So that's the example where a daily QC is critical for ensuring that it's functioning the way that you want to function it. Now, your other high risk area, right, for your centrifuge is your BSL-2 sample processing, right? But here your concern is more with making sure that the speed is accurate, that the temperature is accurate. So here's where you might want to spend your money on your external metrology. You might want someone to come in and verify that your centrifuge is working, that the speed is accurate, that the temperature is accurate, and you probably want to run it again a daily QC, right? You want to make sure that it's reaching your desired speed before you utilize the centrifuge. And then the idea with the risk-based approach is there are going to be some areas where you don't have to focus your efforts. And this is really interesting because our labs where we prepare our testing control articles are often some of our most regulated labs. But if the centrifuge isn't being used in a way which presents any inherent risk, and all you're doing is spinning something to make sure that it's at the bottom of the tube, this may not be an area where you need to do much other than your standard keep the centrifuge up and running, right? So this is an area where for that particular piece of equipment, you might not be investing as much in the way of resources. So reading the chat, routine testing, verify integrity of everything, absolutely. And logbooks so that users can make notes, yes. So one of the best things you can do with an equipment management system is make sure that users have a way to document. So usually generating a system of having equipment logbooks where people are signing when they're using it, where people are recording the QC is critical. And then it also means that if anyone comes in after, they can see that there's been an issue, they may not use that piece of equipment. And I do recommend having a tag in, tag out system. So we do have some really beautiful, big, bright red out of order tags that we can go and we can zip tie to our equipment when we do have issues. Because again, at this level of research, the mindset is often, hey, as long as I can use this, I'm good to go, rather than thinking about what might be the impact on my samples or on my safety if I use a piece of equipment that isn't functioning the way that it's meant to be functioning. So we're going to have another breakout session. I mentioned to keep those 3 different lab environments in your mind. I think this time everyone's going to go into one breakout group. So here the idea is we talked a little bit about the centrifuge and we're going to shift it to a balance, right? So whenever we're doing these breakout sessions where we're kind of giving an example, you can use your imagination a little bit, use your experience. But again, your BSL-3 lab, you're weighing drugs and test articles that are going to go into maybe an animal system. In your BSL-2 lab, you're weighing rodents. And then in your BSL-3 lab, you're weighing fecal samples, but you're only weighing them to determine the minimum amount that should be in each tube. So think about, for your balance, which one of these scenarios you think is highest risk, which one do you think you should focus your resources on, and then maybe what your equipment management system might be for each of those 3. So we have 15 minutes for that. I don't know if it's possible. I know we're getting a little bit behind schedule because of a late start. So if you got, once you guys finish, if you want to hop out of the breakout rooms, if you finish early, we can do that as well and make up time if that 15 minutes is too long. Okay. The second part of this training, as I mentioned, is okay, we've looked at where we need to build quality and how we can build quality, but then going back in and effectively making sure that the system that you've built is working, right? And you want to make sure that however you've implemented quality management systems, it's doing the job that it's meant to be doing. So one of the critical key components is obviously having a good, effective audit system. And you want to make sure that you have an audit system that is structured in a way, and I'm talking specifically about internal audits here, to ensure the ongoing quality in your laboratories. And you need to ask questions such as who's doing the auditing. So you want to try and have someone auditing who's independent from the process that they're auditing, how often you audit, what types of audit, and then how you structure that. And we'll talk about that in a little bit more detail. One thing I do want to say from experience is that for internal auditing, the frequency and the content covered in the audit is absolutely critical. So we have much better results from doing fairly frequent short audits, which focus on one area of interest, versus doing an annual audit where we generate a huge checklist and a huge list of corrective actions afterwards. So even if you're doing small regular audits, you want to make sure that you're following a fairly established audit schedule. And there are a couple of reasons for this. It's because when you're auditing people and when you're going into the lab, you immediately create a sense of nervousness. People don't like the term audit. It's scary. And by having a very set, established process, people get used to it and people work well with you, they trust you. And they also, a lot of these steps may seem like it's excess work, but it puts your auditees at ease. So you want to make sure that prior to going into an audit, you have a defined scope. And this can be very hard because you go in and you audit your labs and maybe you're just looking at their equipment that day and you might start wanting to go down other rabbit holes, but by keeping the focus of the audit, you make sure that you are addressing the area that you went in to review rather than going into a million different areas. You want to make sure that the labs understand that you have the authority to be there. So having top management support is really important. And generally speaking, you want to give the auditee some kind of notice that you're going to be there. And we'll talk a little bit about unscheduled versus scheduled in a moment. No matter how small the audit is, we always make sure that before we start the audit, we take a few minutes to have an opening meeting, right? If this was a big audit, this would be a formal meeting. But if you're doing small routine audits, we still make sure that we take 5 or 10 minutes to discuss with the auditee what we're going to be doing, what we're going to be looking at. And this is primarily to establish rapport. We want to make sure that the people we're talking to, who are often technical staff, are comfortable with us being there. It's also good for us to know what they're doing at that point in time in the lab to make sure that we're not disturbing critical work. And it also develops a sense of back and forth communication, which you need during the audit. Once we've taken that 10, 15 minutes to kind of establish with them, we'll go in and do the actual data collection. We always make sure that for our audits, we have an established checklist for that audit. This is especially critical if you're doing a risk-based quality assurance implementation because the requirements for 2 labs might be different. So you want to make sure that you're auditing against whatever the requirements are for that lab. Because again, we're QA, not biosafety. If we do encounter any safety issues, either biological or occupational health, those will immediately be passed off to the appropriate department. And then we have a closing meeting. And again, because of the way our audit program is structured, that's usually fairly informal, but we will tell them then and there what we found, any points of concern. And again, that means that when they get the formal audit report, it doesn't come as a complete surprise. If there are things which are very, very high risk, we will usually address them there and try and get them in the process of immediate remediation. Your audit team doesn't have to be a large group of people. I do find that usually, even with internal audits, having more than one person is beneficial, but you should assign someone as the lead auditor. That's the person who's going to establish the rapport with the group, and that's the person who's going to handle all of the documentation of the audit. Because that's the person who usually will be on your QA team and will know the requirements for that particular lab. But your team members can really be pulled from a variety of areas, because you may want to pull someone in who's a subject matter expert on something different. So for example, if you're auditing one of your biocontainment labs, you may want to have a team that's made up of QA and biosafety. And really the team members are the people who are subject matter experts. They're responsible for making sure that what's going on in the lab complies with the requirements that have been established within that lab. I would really like to talk about announced versus unannounced audits, because they both have their advantages and their disadvantages, but they serve very different purposes when you're implementing quality assurance. So announced audits are generally what your stakeholders will prefer. They like to know when you're coming. They like to know so that they can make sure that you're not in there at a time where they perceive their critical work as being interrupted. And also make sure that if there are certain people who you need to talk to during the audit, those people are present. However, we all know what happens when you tell someone that you're coming to audit their lab. They clean, they throw away all their expired materials, they make it look beautiful, and you walk into a lab that's not really reflective of the space as it normally operates. So unannounced audits are generally, for a quality system, a much more effective way of detecting non-conformances. We always find more non-conformances when we don't tell them that we're coming. But critically for the lab, it promotes a state of audit readiness. So they never know when QA is going to walk into their lab, and therefore they tend to develop systems which are permanent and which are maintained. And really the expired reagents is a great example of this, because I had one lab way back where, you know, their literal approach was they got audited quarterly, so they got rid of their reagents expired reagents right before the quarterly audit, right? That's not what you want them to do. You want them to constantly have systems to assess and check those problems. And the big disadvantage, though, of those unannounced audits is there are days where you show up and it's just not a good day to do an audit. They might be doing something which is where they really don't want to have extra people in the lab. Maybe there are too many people working in the lab at that period of the time. So you always have to be prepared and to be flexible. But I did mention on the first slide about audits that you should always work with the lab to make sure that they know that you're coming. And one of the critical parts of this is that if you do an unannounced audit, you still want to make sure that you're letting laboratory management know that you're there. The difference is you're giving them notice when you arrive versus advance notice beforehand. And one of the critical things in auditing that people often forget are your soft skills. So our audits are always a lot more effective when we work with the laboratory. I keep using this word rapport, but people are much more comfortable if people are more comfortable with the auditors who are going into the lab and who are watching them work, etc., then we get much more accurate reflection of the lab and its current status. So if you're looking to build an audit program, making sure that your auditors have some training in things such as active listening to make sure that they are able to go and listen to what people are telling them and not necessarily react immediately to things that they see, and keep that kind of good rapport with the lab staff, you're going to have a much more effective audit, and you're also going to end up with a lot more useful information at the end of the audit. So reporting of audits is critical, and it doesn't matter how small the audit is. In addition to those closeout meetings, we always provide a formal report. And the reason for the formal report is not for punitive measures. And I always like to emphasize that it's an internal document. All of your audits should only ever be internal documents. And it's giving the person you're auditing the opportunity to see what you found. So you're going to put not only your findings, but what showed that. If you put very generic, oh, there are expired reagents in the lab, they're immediately going to say, well, I didn't see any. Whereas if you say, we noticed there was expired media or there was expired PPE, and you can say where it is, it's a much better and more useful document for the person who's reviewing it. We also like to include the positive things that we find as well, because generally it's a lot easier to swallow an audit report if you are also hearing the noteworthy mentions. So the things that we've identified in those labs, which are particularly good examples of their quality management system. And that gives them the opportunity to see exactly what we're looking for and the things that we appreciate. I'm looking at the comments, some of our inspections are quick walkthroughs. Yes. Yes. So I used to call them my quality walks. So it's less so now because I spend too much time in the office. I have my team members do it. But oftentimes, if I've been sitting at the desk too much, I'll just go and take a walk through the labs that we work with. And the number of things that you pick up that way is quite impressive. And if we pick up anything sort of larger that way, it often will trigger a full audit. So if I walk through a lab and I see an issue which makes me think, okay, there's something going on, we may go ahead and do an unannounced audit shortly thereafter to determine whether it's maybe a once-off or if it's a bigger issue. But definitely, I always push my team members. This is why I don't understand how quality assurance can be entirely remote. I push them, go around, walk, see what the labs are doing, see what they're doing when they don't think anyone's coming. And it also helps build rapport as well. But we've definitely had instances where we found things and people are like, oh, well, why are you looking through the windows? And it's like, well, because we can and we will. So in addition to audits and our quality walks, there are also incidents that occur which needs to be reported. And actually, in a quality program, reporting non-conformances is one of the hardest things to build out. Within your biocontainment laboratories, people are probably very, very used to reporting biological incidents or safety incidents. They're not so good at reporting incidents as they relate to equipment malfunctions or issues with data. So building out a system where your people can truly report non-conformances is critical. And you have to create an environment where people are comfortable doing that. And this is why I keep going back to the non-punitive environment. If people report an issue and there's an explosive response, they're not going to report an issue again. So you want to make sure that when people are reporting these quality issues, they have a way that they can report them to people they're comfortable with, people who they have a rapport with, and that way you can address them in a way which doesn't cause upset and which keeps the process focused on improvement rather than a punitive approach. So because of that, for our non-conformances, you should have a relatively simple categorization system. I think having minor, moderate, major, etc., can be very, very challenging for people who are reporting non-conformances. And we never ask the staff to categorize them. So for reporting non-conformances, it doesn't matter how small it is. We ask them to report all of them. And then the categorization happens on the QA side. And even though there are 3 categories listed here, there are only truly 2 categories. So the first category are your minor incidents, and we get probably 5 to 10 of these a day. These are very, very small things, which all you're doing is you're tracking the metrics on them. So the reason you track the metrics is that if these things are occurring repeatedly, then you may be concerned that there's some underlying system issue that's causing the non-conformance. Anything else which is causing a high level of risk and is causing harm gets categorized as either a major or a critical non-conformance. And the only difference for us between the major and the critical non-conformance is that with our major non-conformances, the harm has kind of happened. It's something that's in the past. Whereas with our critical non-conformance, there might be something which is ongoing and needs to be immediately remediated before work can continue. So I have this like immediately stop. If you're looking at a critical non-conformance, it doesn't mean the entire lab is necessarily shutting down, but a really good example from a quality side rather than a safety side would be if you have contamination in plates. So you know that there's something that's not right, there's some source of contamination coming in. And if you continue to grow plates under those circumstances, you're going to continue to have contamination. You may halt work until you've resolved the source of contamination to make sure that you're not impacting your future data. So with these major and these critical non-conformances, we make sure that we document those as part of a formal report. And the formal report is critical. It's non-punitive, so we don't use any names in any of our non-conformance reports. And it's also, again, an internal document. And I really want to emphasize the fact that if you want your quality system to function well, all of these checks as such should stay internal, because what it allows is people to have a high level of trust in the system. They don't have to worry about it ever having punitive consequences. And of course, that doesn't apply if something has to be reported externally for regulatory reasons, etc. But the QA document itself should be an internal document. And then with these major and these critical non-conformances, we perform a formal root cause analysis. And performing formal root cause analysis is going to be one of the most critical skills for your quality assurance group. And we'll talk about that a little bit in the acts part of this. So you have your identified nonconformances and you have your audit reports, and you want to make sure that you have a way to track what's happening in your audits and in your nonconformances. So the other thing you want to develop for your labs as part of your checking system is a good metrics system. And your metrics are going to be dependent upon what process it is that you're tracking, but you want to generate a system of having both leading and lagging indicators for your labs. So your leading indicators are I don't want to say they're the most important indicators, but it's important to have a leading indicator because the leading indicator looks into the future. It's a metric which tells you how well your system is functioning, and it's a metric which signals an issue before an incident is about to occur, right? But you also want to include metrics which are lagging indicators, because these are the metrics that are such as number of incidents, right, which are measuring how effective your system has been in the past, and changes over time can show that your system has improved or that your system is more effective. So when you're building out these metrics for either your lab or for your biocontainment operations, you want to make sure you balance the two. So because we're kind of have a focus on biocontainment laboratories here, I did want to give you guys some examples of leading versus lagging indicators that you guys can build into your monitoring systems. So for your biocontainment labs, right, you have a heavy focus on safety. You want to make sure your PBE is effective. So your leading indicators are things such as whether or not when you have an incident, you're performing RCA CAPA, how many trainings you're performing, how many risk assessments you're performing. So a lot of these things are showing that you have a functioning, effective system because it's being performed. Whether or what percentage of your employees are trained is an absolute critical leading indicator to an issue within a biocontainment space. And then your lagging indicators that you want to track within your biocontainment spaces are things such as near misses, obviously incidents, failures. If you're looking from a quality side, study deviations would be a really good example of a lagging indicator, right? If you have an increase in your study deviations or your numbers of studies which have been abandoned, your quality system within your lab is probably failing, okay? So as you build out your check system, you want to make sure that in total, you have a system which is effectively giving you that you're detecting items through audits, through walkthroughs, that you have a good non-conformance and non-conformance management system. And then in the background of that, your QA group should also have a good number of metrics that they're tracking over time. And all of those things allow you to continually go back and detect whether there are issues within your system. Let me see, can some of these indicators be... Absolutely. So a lot of your indicators will be connected. For example, even with your leading and lagging, I can tell you that you're going to see relationships between even your safety and your quality indicators. So for example, if you have an increased number of biosafety trainings, you're generally going to see some lagging indicators successful, for example, your reduction in study deviations. And that's often because that training overall is indicative of personnel who are getting well trained, who are performing studies better. You don't have issues with employees leaving the space. So a lot of these do in some way, a lot of these can measure very similar things, and they can sometimes kind of indicate a similar root cause or root issue when they're starting to go down. A very good question. So we have a little bit of a longer breakout session here because I think that auditing and non-conformance reporting is a critical part of a quality management system. So the discussion points for this breakout session, I think we should stay. Do you guys, I was going to put you in 4 again. Do you prefer being in 4 or in 2? Any preference? None? Okay, we'll probably go in a group of 4 again. So to think about your current audit system, and it may be a biosafety audit system rather than the quality audit system, how you manage incidents and non-conformance reporting. If you're on the lab side, especially, what's your system for reporting? Who do you report up to? And then given the current work and the areas that you focus on, what metrics might you think would be critical for your quality assurance program? Okay. And again, if you finish the breakout group early, you can definitely hop back and that's an absolutely great discussion. That's awesome. So we're going to move on to the final leg of the journey through our plan, do, check, act, which is the act. And this is possibly the part where your quality system can start to fall apart, because the issuance of corrective action requests is critical to fix issues, but is also one of the most challenging areas to make sure that people listen to, that they conform with, and that actually functions the way that it's meant to. So when you're issuing a corrective action request, it's usually in response to maybe a non-conformance that's been reported or something that you've detected during your audits. And in these corrective action requests, you want to have usually a good mix of what you're asking them to do. So some of those actions will be remediation actions. And our remediation actions often come before the corrective action request. They might be things that you've detected in the lab that just need to be fixed straight away. You're not necessarily worried about what's caused them. They're just a problem that needs to be resolved. Most of what will be in your corrective action requests are your corrective and your preventative actions. So your corrective actions are great. They fix the undesirable thing that you saw. Maybe they throw away all of their expired reagents that you see in the lab, but it's not fixing the root cause. It's not fixing the reason that that issue was there in the first place. So what we really want to get to are our preventative actions. And these are the things that are going to identify why the nonconformance or the incident happens and hopefully prevent it from happening in the future. And I can't emphasize the next slide enough, which is that your corrective action requests will not be effective unless you identify the root cause. Because if you don't identify the root cause of the issue is going to keep recurring over and over again. And you're going to find yourself in a situation where you have a bunch of corrective action requests changing a bunch of different causes, but you never actually fix the root cause, because the root cause is what's going to be ultimately resulting in the nonconformance. So just to change things up a little bit, I'm intrigued to know, in your labs, in your programs, do any of you use a formal root cause analysis, a formal root cause analysis and corrective and preventive action plan or planning program, or do you just informally handle those instances? So I think we have a poll that can be thrown up. Maybe.
Whoops, I have opened the poll, but I am assuming that none of you can see it. Oh, wait, no, people are answering. Okay,
Okay, awesome.
thank you. Okay, I think we may have everybody in. Hey, Carys, can you see the results?
I could not see the results. So since we've only got 4, do you want to tell us what the...
Sure. So 50% say yes, it is required, and the
Okay.
other 50% say yes, but it is not required. So I'll
Okay,
let you discuss that.
fantastic. So everyone's actually doing a formal RCA CAPA process. That's quite exciting. So that does lead me to a secondary question, if no one minds speaking out. What process are you using right now for your RCA CAPAs? Does anyone want to share?
Okay, Louise did share in the chat that it is not required, but it is implemented. And
Oh, wow, you use a lot. Okay.
so if you're reading that.
Okay, so you use a big variety of tools, which is awesome. So for what we're going to talk about today is what a method that we've started utilizing primarily because one of the regulatory agencies encouraged our use of this method, and it's a very simple, straightforward method. So we'll talk through that specifically, but we do allow some flexibility for people to use different tools as appropriate, because obviously different methods of root cause analysis fit different circumstances better. So for those of you with less of a background in RCA, the types of causes that we're looking at are your basic causes, right? These are your surface level things. They are the the immediate things that people jump to, lack of training, things like that, but they're not necessarily actually the root cause of the incident. And often they expand and further the issue, and they may even impact the severity, but they're not the underlying systematic issue. Whereas your root causes are the things that are ultimately the primary drivers of a nonconformance or an incident that you encounter. Whenever we're trying to do a root cause analysis, our goal is to get to that root cause so that we can issue an appropriate CAPA for that root cause. So in order to do that, I basically came up with a two-step method that initially starts with a brainstorming to isolate all of the basic causes, and then a root cause analysis to isolate the actual, ideally, root cause or causes. So we do something called initially a cause or effect analysis, which is the same thing as Luis used, they call it the Ishikawa, but it's the same idea. It's also known as a fishbone analysis. And we only use this to identify all of the potential causes, right? So the idea of this method is you have this little guy here, which is can be called a fishbone. I like the term fishbone because it does look a little bit like a fish. And you write down what your issue is, what your problem statement is, what occurred in this particular incident, and then you can break your all your potential causes down into categories. And again, whenever you see any of these methods, there are a variety of different ways you can do it. I think there's like a 9Ms as well, but we selected what's called the 6Ms method, which is where you break them down into measurement, materials, method. Environment is not an M, but it was Mother Nature in the original 6Ms, manpower and machines. And what you do is you go through each of these different categories, okay? And you look at each of these different categories and you try and determine what things may have resulted in the identified non-conformance or the incident. Now, this is a very powerful tool, but it's only a powerful tool if the people who are performing the analysis have a good understanding of the issue that they are discussing, right? So if you have an incident that occurs in your lab, you probably don't just want your QA team sitting working on it. You probably want to pull in information from your lab technicians. You want to pull in information from your biosafety personnel. The strength in this is that once you have all of those subject matter experts sitting together, you can identify all of the things that may have had an impact on the problem statement. And then once we have all of those identified causes, we look at one of these areas, because usually when you do it this way, you'll see that one of these areas is a primary driver. It's something which is clearly the underlying issue. And then we perform the 5 whys analysis. And again, we choose this method because it's relatively easy. It doesn't require a huge amount of training. And the 5 whys method is truly as simple as saying why. It's like, well, your toddler comes up to you and says, why? It's exactly the same idea. So for example, PPE was not correctly donned. Well, why was PPE not correctly donned? Maybe and as you go down each of those sequential questions, you determine at each point whether it's the root cause. Okay, so basically you keep asking why. It's called the 5 whys, but you don't have to do as many as 5 or as few as 5. It's just on average, you'll probably ask why about 5 times. Now, the one risk with this root cause analysis method is that if you do root cause analysis enough, you'll realize that it always eventually goes back to management. It's always a failure of management to have done something, provides a resource, provided a tool, and we can't fix management all the time, right? So one of the skills when you're doing 5 whys is to realize when you've identified the root cause at a point where you can prevent it and fix it. So for example, if there is an issue that ultimately is management's fault, maybe there's a policy that needs to be put in place. Maybe there is something that can be fixed without replacing your entire top management system, right? So that's sort of the weakness of root cause analysis, is that really that is the fundamental driver of all of the issues in your institutions. So once you've gone through the root cause analysis, the next step that you want to take is to determine how you are going to provide those actions, those corrective and preventive actions, in a manner that will actually remediate and resolve the issue that you're having, okay? So what we want to look towards are, I'm sure you've all heard the term SMART actions. So these are things which are specific, measurable, achievable, relevant, and time-bound. And what that essentially means is with your corrective and your preventive actions, you want to assign an individual who's responsible. Now, it's very, very common for people want to assign departments. I like to see a name on the who's responsible whenever I see a CAPA come out, because I want to know that this person is the person who is responsible for ensuring that it's complete. It doesn't mean that they're doing every single step of the CAPA. That's just the person who's making sure that it gets done and it gets resolved. The what, obviously, are the actions necessary, and this is where you may want to add your metrics in. You might want to look at your leading and your lagging metrics. They're going to measure the success of the action, and you also want to outline what resources are needed in this instance to allow that corrective or preventive action to be completed. And then the when, and I still have to push back against this one because people always want to write ASAP or as soon as possible before the end of the month, something like that. I'm like, it needs a date. If you mean ASAP, then you want it done tomorrow, right? But if it can't be done tomorrow, then what's a reasonable time frame to actually do it? And the reason it's critical to have these actual dates is these dates determine when you're going to go back and check to make sure that this corrective and the preventive action is complete. So if you want something done by November 1st, then you probably want to go in the lab November 2nd and make sure that it has been completed. So we issue these CAPAs in the form of corrective action requests, and these may be issued as part of a non-conformance report, as part of an audit report. And we always make sure that if it's a non-conformance report, we do actually state in our corrective action request what the root cause is. And by letting the lab know what the identified root cause is, it also gives them a chance to think about other issues that might have resulted in. And one of the things I want to emphasize here is that when you're issuing a corrective action request, this is a document for discussion. It's not a document that is punitive. Here's your corrective action request, fix it and be done. There should always be an associated discussion with the personnel involved to make sure that it's reasonable. Maybe your timeline isn't reasonable based upon the resources that are available within the lab. It should be something that everyone who's involved in understands and can work towards and can use to build out an effective system where you're actually improving and closing the gap that's identified. And then one of the other critical things for your whoever's managing your quality assurance to do is to build a system for tracking open CAPAs. Because if your CAPAs aren't getting closed in a timely manner and your CAPAs are things which have already resulted in non-conformance, they have a potential to cause further non-conformance before they're closed out. And this is what this part of it is. So after issuance of that corrective action request, you need to make sure that it's completed, but you need to continue to track your metrics. And the reason you need to track your metrics is that everyone makes mistakes. Even your QA people make mistakes. And sometimes something that you have issued to prevent a root cause that you have identified actually has knock-on effects and potentially causes further issues, causes further non-conformances. If you're not going back and keeping an eye on your metrics and closing the loop and making sure that whatever you have asked the lab to implement and to introduce has effectively closed and finished up, then potentially your corrective or preventive action may actually result in a negative change for the program. And the entire point of a continual improvement initiative is for you to constantly be getting better. So making sure that you close those CAPAs is absolutely critical. So for our last activity today, this is kind of an interesting one. So we have a scenario, and I'll actually share this screen to your breakout group so you can read this in real time. It's a small incident that you guys might see any day working in your labs. And without being too, you're gonna have to use some imagination because I didn't write all of the details in here. Think about what some of your contributing factors might be. You can use a fishbone if you want to try and brainstorm out some of those contributing factors and select a priority area. And then try talking through a 5 whys analysis. So once you've selected what you think is causing the problem statement, what's the priority area? See if you can talk through those 5 whys and come to a root cause. And once you have your root cause, think about what potential corrective and preventive actions you might be able to generate to work through your root cause. Now, I gave this 20 minutes, but I'm aware that this one might take a little bit longer. So if you guys need more time, just let us know. Or if you guys finish early, you can hop out. Any questions? Make sense? So I will share this to the breakout room once the breakout room's open. If you have any issues seeing it, just let me know. Absolutely. I love that you come back to the risk assessment and that to assess the process as a whole and identify risks that haven't been identified, because that's an absolute critical part of this, is that it's all cyclical. And if you have those risks that aren't identified in the first place, you're not ever going to have an effective management of your bio risks, your quality risks, or any other risks that are inherent in the system. That's very interesting. I always enjoy hearing when people do an RCA CAPM because it's always interesting to hear the outcomes of it. So that sounds great. So we're getting close to wrapping up. We've just got a couple more slides left for you guys. So these are kind of the final thoughts on quality management in your biocontainment spaces. And one of the critical things to remember is that implementation of quality management can fail. And there are a lot of reasons why it does fail. And one of the most common reasons for it failing is having a quality management system which is extremely complex. It's extremely unwieldy, and people don't want to comply with it. If people don't want to comply with your quality management system, it's always going to fail. And what it's going to do is it's going to change the relationship between your quality personnel and the personnel who are trying to work in the lab from being something which is a relationship of trust and building a quality system into something where the quality people feel like they have to be punitive because no one seems to be listening to what they're doing. But then the result of that is no one wants to listen because there are too many things. Having too many gaps in your QMS. This is why root cause analysis is so critical. If you don't do your root cause analysis when you do have an incident, what's going to happen is you're going to issue a bunch of CAPAs, and then maybe they'll resolve those CAPAs, maybe they won't, but then the issue is going to arise again, and it's going to arise in a different way, and maybe you're going to get some different CAPAs. And you end up with this ongoing system where you keep issuing corrective actions, nothing ever closes, you keep having non-conformances, and it's just not effective. And when you start to have a system like that, the cost of the system becomes too much. It's not benefiting, it's not helping anyone. And then the last reason is a lack of top management support. When these systems, for you to really have a good quality management system, top management, the people who run the programs, the people who run the institution, they have to believe in the quality system and the benefit that's providing. And I kind of want to circle back to what Louise said at the start of this, which is that to have an effective quality management system, you have to have a good rapport between the people who are providing quality assurance support and the stakeholders of the system. One of the ways you lose that rapport real quickly is if your quality assurance people don't realize that they are not the subject matter experts on anything but quality. So as they start to work with your stakeholders, it's critical that you listen to your laboratory technicians. It's critical that you listen to your biosafety personnel, because in order to improve the quality of what they're doing, you have to respect the fact that they are the subject matter experts in those areas. So the quickest way to lose a stakeholder, especially a principal investigator, is to not respect that they are the body of knowledge when it comes to the science that they do. So this is why quality management in these labs, especially if you're in an unregulated space, it's critical to implement in a way which is data-driven, where you listen to your stakeholders and where you make sure that you're going back in, that you're checking the success of your implementation, and that you're ensuring that the way that you're implementing quality is cost-effective and works well with all of the people who are having to utilize the system. So the question I get all the time is, who audits the quality management system? So if they're going in and they're auditing the biorisk management system and they're auditing the lab systems, who actually goes back and audits your quality system and whether it's effective? Well, obviously, any system, whether it's biosafety, lab system, quality, self-audits are always critical, right? But it's also critical to get feedback from your stakeholders. So I was talking about with having two-way systems. If you're implementing a quality management system in the lab, you should be hearing from the technicians, the principal investigators, is this working for you? The facility itself should have checks and balances for the quality management system, which is why top management is so important. They should be reviewing what your quality group is doing and making sure that they are successful. If you are working under a regulated quality system, obviously you can have external companies who will inspect you and audit you for your GLP or ISO compliance. And then you can also have external consultants who assess your QMS and determine the gaps in your system. But the primary recommendation and the number one thing to remember here from today is that right now, everything's about cost. Everything's about doing things as effectively and efficiently as you can and doing it right the first time. And having a well-structured quality management system that looks at risk, that makes sure that the systems that you're implementing are reducing risk and are enhancing your research and your safety will mean that the processes and the program that you're building within your biocontainment operations is better, it's more effective, and ultimately helps you build towards being the gold standard in your research organizations. So with that, we've got about 20 minutes left. If anyone has any questions or there's anything people would like to discuss, I'll open the floor.
I guess one question I have is kind of in your experience, what have you seen to be effective to help kind of get people to buy into quality assurance and maybe coming from the research side that how do you get them to buy into quality assurance when they maybe are unsure or have questions about it?
So it depends where they're coming from. So sometimes simply helping them out with somewhat related things helps a lot. So one of our big ways of getting buy-in from labs is assisting them with things that they know they need help with. So inventory management, making sure that we do the freezer oversight of the remote monitoring of the freezers, helping them see that there are ways that quality can impact them without it negatively impacting. One of the things we have to fight against is, especially people who are coming from a regulated QA environment, they just see quality assurance as red tape. It's another layer of red tape that's going to come in, it's going to slow them down, it's going to tell them what to do. But working with them and informing them and teaching them that that's not what we do at all is one of the most critical things. I think that the biggest challenge I have is if one of my quality assurance personnel gets seen as being very much like a compliance heavy regulatory stance, no one wants to work with that, right? So having good rapport between your quality assurance officers and the labs, being available to support rather than coming in from a punitive side and telling them what to do is absolutely critical. The other way to get buy-in more often than not, and often the ways that we end up connecting with these labs are when non-conformances do happen. And all of a sudden, these labs are faced with situations that they have to report where they don't know how to report them, where they don't know how to handle those internally. And we can assist with that and we can help show them the way that they can build. But really, it's about building a quality culture. I think that we have several campuses here at Tulane, and the more quality assurance you have in an area, the faster it grows. When you have an area where there's no QA, it's very hard to start that initial expansion and that initial sort of propagation of the program. But education's the best way, teaching people, adding donuts and coffee to your lunch and learn so that people
That
are
was smart.
motivated
Yeah.
to come is definitely always a good mechanism. So
Awesome. Thank you.
welcome. Anything else?
Going once, going twice. I will go ahead and let everyone know that at the conclusion of this training, you will be receiving a survey by email. We would love to get your feedback on not only the presentation, but also kind of the environment that you were in. And also everyone will be receiving certificates via email for successfully completing this module. And also, please stay tuned for future events. More than likely, our next virtual event will not be until the kickoff of the new school year or semester in the fall. So be on the lookout. And then also for any of you that are at Tulane, also please be on the lookout for any internal opportunities that we will have through the Institute as we expand into that space. And if you're interested in Carys services, our quality assurance unit does provide consulting for external institutes, as one of her slides did mention. But then too, for our other campuses that are really starting to gather interest in implementing quality in their spaces, we do encourage you to set up meetings with Carys or some of her officers to discuss what that will look like in your lab space. But with that, I think that we may be able to give you back 15 minutes of your day unless anyone has any other follow-up questions. Okay, I think so. So with that, thank you again, and we hope to see you again in the future. If anyone has any questions about Biocontainment Institute programs specifically, you can reach out to tubi@tulane.edu or reach out to me at hcallison@tulane.edu directly, and we'll be sure to get you more information about those programs. Okay. Well, thanks, everybody. Have a great afternoon.
Thank you all.